Hello, hello. Welcome to Clinical Psychology, Chapter 15, Group, Family, and Couples Therapy, Key Terms and Definitions. Ready to study? Behavior Therapy Group. An approach in which patients with similar problems are treated as a group using standard behavioral or cognitive behavioral methods. Behavioral family therapy. An approach to family therapy that views family relations in terms of reinforcement contingencies. Therapist's role is to generate a behavioral analysis of family problems and induce family members to reinforce each other. Behavioral motival therapy? Confusing words. A form of couples therapy that applies principles of reinforcement to a couple's interactions. Major components include contingency contracting, support understanding, and problem solving. Collaborative family therapy. A form of family therapy where each family member sees a different therapist and the therapists meet periodically to discuss their patients and the family as a whole. Communication. The verbal or nonverbal exchange of information about facts, feelings, and thoughts. Concurrent family therapy. A form of family therapy in which one therapist sees all family members in individual sessions. Conjoint family therapy. A form of family therapy in which one therapist meets with the entire family at once. Contingency contracting. A technique in which spouses are trained to modify their own behavior to bring about a specific desired change in the behavior of their mate. Couples therapy. A form of psychotherapy in which a couple meets with one or more therapists to work on any number of issues. Curative factors in group therapy. The commonalities among diverse group therapy approaches proposed by Yulum to be the source of positive treatment effect. Double-blind. A case in which an individual is told two contradictory messages by an important figure in his or her life, such that every response he or she makes with regard to that figure is wrong. Emotionally focused couples therapy. A form of couples therapy that is based on the assumption that marital distress results from negative affect and destructive internal styles. Family therapy. Several members of a family are seen by the therapist in addition to the identified patient, based on the idea that everyone in a family is affected when one member of the family develops a problem, and that the home environment may have contributed to it. General systems theory. An important concept in family therapy that conceives of the family as a system and believes that pathology is best reduced by altering the way that the system functions. Gestalt groups. A group approach in which the therapist focuses on one patient at a time and asks the patient to experience his or her feelings and behaviors, while the other group members are asked to observe or provide feedback to the person. Group therapy. A form of psychotherapy in which one or more therapists treat a number of patients at the same time. Generally speaking, most groups consist of 5 to 10 patients who meet with the therapist for at least once a week for a 90 to 120-minute session. Multi-systemic therapy. A form of family therapy originally developed to treat antisocial behaviors in youth. It is unique in that it is administered in the home, school, or neighborhood. Problem-solving techniques. Training couples in positive communication skills to enhance the effectiveness of decision-making and negotiation. Psychoanalytic group psychotherapy. Generally speaking, psychoanalytic therapy carried out in a group setting. Group dynamics are considered secondary to individual processes, and the group acts as a vehicle through which the individual may obtain insight. Psychodrama, a form of role-playing developed by I can't pronounce their name, in which one patient in a group acts out a role assigned by the therapist. Other patients serve as the supporting cast and the audience. Support understanding techniques. Techniques that aim to increase partners' positive feelings and behaviors. Time-limited group therapy. A group approach to brief therapy forwarded by Bodman and Gorman, in which patients meet weekly for a predetermined number of sessions. Transactional analysis, a group method developed by Bernie that focuses on the ego state's child, adult, or parent. that are evident based on patients' transactions with other group members. Thank you for joining us for Chapter 15, Group, Family, and Couples Therapy Notes, Key Definitions, and Words. Thank you, and good luck studying!